Hello viewers, today I welcome you to the lecture of Basics of Ophthalmoscopy by me, Dr. Asif Mahmood Rafi. So who would be watching this video? I just want to mention that any medical student of medicine or interns or any medical officers aspiring for the examinations like FCPS, MD or MRCP may need this tutorial to understand simply how the ophthalmoscopy should be done and should be presented. So let's start. The first thing is the basic examination steps. So at first, what should we do? At first, we would go in front of the patient and greet with the patient, whatever you can say, assalamu alaikum or good morning, anything else. So after that, you first introduce yourself, like I am going to introduce myself like this, that I am Dr. Asif and now I am going to examine your eyes or examine the back of your eyes. So after that, the first thing is to ask the examiner to dim the light. Whenever the exam setting is, we should ask the examiner to dim the light. After that, we need to ask the patient that please look straight. It may be towards the fan or towards any specific thing, and then we should ask them to not to move his eyes, but he can blink if he wants. So it is very important to ask the patient, to tell the patient that if you can move the eyes, but you cannot move the eyes, but you can blink if you want. If you feel any discomfort, just let me know. That should be the instruction. And after that, we need to put the light on and then see the pupil first. And at first we need to see the pupil, because seeing the pupil gives us so much idea about the diagnosis. So after that, we go inside the eye, and it is the right hand with the right eye and the left hand with the left eye. And after that, after examination is finished, we should ask the patient to look towards the light. For seeing the macula, it is important. So after that, we just thank the patient for his cooperation, and that's it. That's the basic examination steps of an ophthalmoscopic examination. So after that, what will be the findings? So I say that people see, but clinicians observe. So the important thing is we have to observe the patient from the very first moment. We enter the hall, examination hall, we see the patient. It may be examination hall, or it may be any practice, any chamber, or anywhere you are seeing the patient. So we need to observe the patient. So what should we observe? At first, we need to observe the age of the patient. The age gives us so many details. Like if the patient is in the older age group, it may be type 2 diabetes mellitus or maybe hypertension, but the younger ages we find more hypertension or optic atrophy like this. These patients present at a younger age, so it is important. And then the appearance. What is the appearance? Like if the patient is obese and we can see that there are polydactyly present, so that can indicate Lawrence Moon Beetle-Bardet syndrome. That indicates the patient may have retinitis pigmentosa. So for some people it may be something of difficult diagnosis, but it is easy because we need to observe, and then we will observe the pupil size, because the pupil size gives us idea whether the patient has diabetes or not, because we know that in diabetes the mydriatics doesn't work like the other patients. So if we find that the pupil is way enlarged and dilated, so it sometimes gives an idea that the patient may have only hypertension or optic atrophy. Then the reaction to the sharp light we are putting on the eye, that gives us idea whether the patient is feeling the light or not. If the patient is not feeling the light, it may be the patient may have blindness, so it can be optic atrophy. So it also gives us idea. So what we need to do as we start seeing the patient, we need to think something in our mind. So it is very important. So we just now go to the clinical findings that are of importance. So at first we see the media. We put the light and we see the media. So the media is hazy, it may be cataract. So cataract patient may have diabetes because the diabetes is a risk factor for developing cataract, and the media may be clear. So it is important. And the red reflex is mostly synonymous to the media, and if the media is clear, the red reflex is present, and if the media is hazy, the red reflex is absent. So, and then after that we put the light and go inside and see the disc. So what we see in the disc is the margin and the color of the disc and the vessel count. These are the basics. So what is the margin? So if the margin is clear and the shape is regular, normal, it is normal. And if the margin is blurred, it indicates towards papilloedema. Papilloedema may be due to any increased intracranial pressure, or maybe due to hypertension causing stage 4 hypertensive retinopathy. And then we come towards the color. The color may be pinkish in case of normal, and if we find that the color is in the pale side, so it can be optic atrophy. So then we go towards the vessel count, and if the vessel count is 6 or more, it indicates normal. And if we find that the vessel count is less than 6, so it may be optic atrophy. So these are the first findings. Then we go towards the retina. We see the disc first, and after that we go towards the whole of the background, that is retina. So in the retina, what should we look for? As we are progressing, we have some diagnosis in our mind. So if we think that this patient may have diabetes mellitus, so we will find some specific things, like the whole background will be reddish compared to the normal one. So that indicates there may be dot and blot hemorrhages. We are not sure that we will find the specific dots and blots, but the whole background may be slightly reddish compared to the normal one. So these are the first finding. And then we come towards the hard exudates, and the hard exudates are the exudates which have sharp margins, which we find in diabetes mellitus. And we also find the blackish spots in some retinas, and that indicates in diabetes there are photocoagulation marks for the treatment of diabetic retinopathy. So if we find the blackish spots, that indicates photocoagulation marks. And after that, if we think that the diagnosis may be hypertension, the hypertensive findings, the most important findings are the AV nipping. Nippings are found mainly around the disc, main optic disc, and around the optic disc we find the nipping. And we find the flame-shaped hemorrhage may be dispersed. Flame-shaped hemorrhage, these are the irregular shaped hemorrhages. So that is different from the dot and blot hemorrhages. So these are irregular shaped. And the soft exudates, are unlike hard exudates. They have fluffy margins. The hard exudates have sharp margins, but the soft exudates have fluffy margins. So these findings indicate towards the hypertensive retinopathy. And lastly, the other thing is important, that optic atrophy. If we find that the total background is pale and there is decreased vessel count, so it indicates optic atrophy. So it is very important that in optic atrophy we find the background pale, and the vessel count, we find the vessel count is less. And the next we see in the retina, if the total background is full reddish, so it may be retinal hemorrhage, which may be a complication of diabetes or some other things. So retinal hemorrhage would be the diagnosis. And lastly, the black speculated appearance of the periphery in the retina. If you find something like that, this is a differential of the photocoagulation marks, but the photocoagulation marks are rounded, and retinitis pigmentosa, there is speculated appearance in the periphery, so that indicates towards the retinitis pigmentosa. So thanks for watching. These are the basics of fundoscopy, and we have to know that as we enter seeing a patient, we have to observe keenly not only the findings but also the appearance, the age of the patient, the reaction to the light, the pupillary size. So these are very important. So that's all about fundoscopic examination. I hope that you like the video.